Ms. Smith. My name is Kathy. I'm going to be the nurse performing your abdominal assessment today. Were you able to empty your bladder before coming in?
Yes.
Okay, I'm going to have you lower both hands down by your side, and I'm going to grab this pillow and prop it under your knees. Okay. Normally, I would lift your shirt up to the bottom of the xiphoid process and pull your pants down right over the symphysis pubis, but today I'm going to leave your clothes in place to maintain your privacy. I'm going to inspect your skin, looking for any discolorization, any purple tints, redness, any sign of bleeding under the skin, looking for scars or open wounds. Also going to look for dilated veins and look at the umbilicus and see if there's any protrusion from the umbilicus, from any masses around or under the skin. I'm going to get eye level and look and see if the abdomen is symmetrical or if there's any bulging or swelling, indicating that there may be any enlarged organs. I'm also going to look for peristaltic waves, which could indicate intestinal obstruction, and look at the aorta and see if a pulsation is noted. A slight pulsation is okay, but any vigorous pulsation could indicate abnormality. Okay, the next part of the assessment is the auscultation. I'll take the diaphragm of my stethoscope, make sure it's warm, and apply it to the skin. Starting in the right lower quadrant, listening for bowel sounds, and move clockwise. Listening for hyperactivity or hypoactivity, less than 5 sounds per minute or over 30 sounds per minute. There should be 5 to 30 bowel sounds per minute, and you should listen in each quadrant for at least a minute, and the maximum 5 minutes. If no sounds are noted in one quadrant after 5 minutes, it's considered absent, and we do consider that an emergent situation. I will then take the bell of my stethoscope, which this stethoscope is single-sided, so I will lightly press the stethoscope to the aorta to listen for any bruits or whooshing sounds, and then move to the renal arteries, the iliac arteries, and the femoral arteries. I will then take the bell of my stethoscope and lightly press it to the umbilicus, listening for a venous hum indicating poor circulation. And then take the diaphragm of my stethoscope and listen to the liver for friction rub, which will be a high-pitched grating sound, and to the spleen for friction rub. The next part of the assessment will be percussion. I'll apply my hand gently to the skin and gently tap on my fingers. This will be to listen for the tones in the abdomen, to check for any gas or distended abdomen, to check your liver and your spleen. And I will start in the right lower quadrant and work my way around clockwise. Checking for dullness, and it should have tympanic sounds. I'll now start at the midclavicular line and work my way up to check the size of the liver until I hear dullness. And I'll make a mark with a marker, and when I find the lower border of the liver, and then I'll start at the chest midclavicular line and work my way down until I hear dullness again. And that will be the upper border, and that should measure 6 to 12 centimeters for normal size. I can then do the same thing with the mid-sternal line. And then work my way up. And then that should measure 4 to 8 centimeters. I'll then come over to check the spleen. And I'll do the same thing, start up top. And then come down and work my way up. And that should also measure 4 to 8 centimeters. Okay, the last part of our assessment is palpation. So I will gently apply my hand to the skin and I will gently palpate, pressing in 1 centimeter in all quadrants, feeling for any rigidness or hardness, which is normally noted towards the sides. Are you feeling any pain or tenderness as I press?
No.
Okay, and then I'll go in about 5 to 6 centimeters, pressing and looking for the same thing, any abnormal large masses or firm areas. I will then go up to the liver and place my left hand under the back and my right hand at the right costal margin to check liver size. And inhale, and I will press inward and upward and exhale. Okay, I can also check for liver size by placing both hands at the right costal margin and inhale, pressing inward and upward and exhale to check for liver size for enlarged liver. Then I'll move over to the spleen, placing one hand behind the back, and then inhale and exhale. And the spleen should not be palpable. If it is palpable, it is likely enlarged. I'll then move to the kidneys, which should also not be palpable, and then down to the symphysis pubis to massage the bladder, which should also not be palpable if empty. I'll then go up to the aorta and feel for a bounding pulse. Okay, that's it. Is there any questions that you have for me?
No.
Okay. Okay, Ms. Smith, that concludes our assessment. No abnormalities were found. Your skin looks fine. While palpating, I felt no abnormal masses, and your liver measured the correct size. So if you have any questions when you get home, feel free to call us here at the office. And that concludes our assessment.